Today I have a very, very special guest for you who I'm so excited to talk to. And that person is Satveer Kaur-Gill. She is a researcher. She was a 2019 to 2020 US-ASEAN Fulbright Fellow. She's been doing a lot of work on public health issues, particularly in Singapore, and she has a lot to tell us today. And I'm going to bring her in now. So Satveer, welcome to the show.
Hi, thank you so much for having me.
Excellent, excellent. So we're going to get into your research. We're going to get deep into topics of public health. So my first question for you is, were you a very curious child? Were you always the one asking lots of questions to your parents on lots of different topics?
Unfortunately, I wasn't. So a lot of these questions of health inequalities and my interest in communities that reside in the margins of our society started to dawn on me at a later stage in life. So during my undergraduate education, where I was exposed to a lot of these conversations in the campus environment, that sort of triggered a lot of my interest in the subject of health inequalities, and that led me to my path as a critical health communications scholar today.
Well, that's very normal. I think when people are children, hopefully when you're a child, you don't have to think about these very serious issues. But then you start going to university, you start studying, you realize how many different challenges there are for people all over the world, in your community, in your country. So was there a specific moment when you said, okay, public health, I'm passionate about that. That is what I want to study. Was there a professor? Was there a certain aha moment? What made that topic click for you?
I think I would say there were many moments. I wouldn't sort of put it to one single moment in particular. However, being exposed to the different ways in which inequalities sort of reside in our society was a reflexive moment for me, coming in as a scholar that had a very different lived experience, while also understanding that as coming from a minority population, the different ways in which we interact with different structures are going to be sort of give us insight into different ways in which we access healthcare systems, the ways in which we communicate with our doctors. So that led me to think about, hey, what about groups that don't have those access points, So what are the ways in which we can think about health inequalities for people that may not have the same types of privileges, the same types of contexts that a lot of us do have. And that sort of got me thinking. At that point in time, then I started interacting with professors that have a very similar research interests, and a big inspiration of mine has been my own supervisor, Professor Mohan J. Datta, who does a lot of work with disenfranchised communities all over the globe. And I think his perspectives and his theoretical insight really helped me think about some of these issues much more deeply.
Mm-hmm. Mm-hmm. Definitely. So many people in the audience are not from Singapore, and maybe even some people who are in Singapore don't know a lot about the demographics in Singapore. And since a lot of your research was about minority communities and migrant communities in Singapore, if perhaps you could just take a moment to talk about the demographics in Singapore so that we have that context.
Sure. So we are a multicultural population. It is predominantly a population of those coming from having a Chinese ethnicity. So they make up the majority population. And then you have minority populations such as the Indian population and the Malay population in Singapore. Also making up this multicultural context is, of course, immigrants and migrants coming into the cosmopolitan center. You have migrants that make up the more affluent aspects of society. But you also have migrant workers that come from various aspects of society where they might not get access points, such as your migrant construction workers who do difficult, dangerous labor. And then you have domestic workers that do caregiving labor. So this labor is often in the peripheries of our society. They don't often get symbolic as well as material recognition. So it's often very hard for them to navigate different health environments just by nature of their erasures in Singapore society.
Absolutely. And certainly, even if someone is not in Singapore, every country has migrants. Every country has immigrants who are there. Sometimes they're unauthorized, sometimes they are authorized, and they get sick just like everyone else. And then issues come up in terms of access to healthcare. So did you research these topics when you were in the United States on your Fulbright program? Was that part of your study there?
So it was a continuation of that study. I've been researching on migrant issues since the start of my PhD program in 2014. When I went to the US, it gave me a very different lens into how to think about migrant issues in a much more in-depth way and in a much more rich way. There's a lot of great work going on at UC Berkeley, where I was situated for my Fulbright program. And there was where I met with different scholars who are working on different aspects of migrant issues, low-wage migrant issues. This was also the time where the COVID-19 pandemic outbreak took place. And that was where I also started to think about the ways in which migrant workers were going to be afflicted by outbreak inequality just by nature of how we understand how precarious they are in various societies. So that experience really gave me a lot of opportunities to think through the concept of outbreak inequality and the ways in which it might permeate across migrant worker sectors in various aspects of society.
Mhm. Well, a couple things. First, I just have to give a shout out because you mentioned a university in California, and everyone can see the Golden Gate Bridge before me. I'm in Northern California, so I love when people mention universities in California. Personal bias, sorry. But moving on, you were there in 2020 doing research when the pandemic struck. And there were a lot of discussions, a lot of policy debates over how to handle different immigrant communities in the United States. So I'm sure you were exposed to a lot of those discussions and then thought about, okay, how do I take what I'm hearing, the US debates, and put it into the context of Singapore? So that was quite an opportunity for you to hear all those perspectives. Now, how did the pandemic affect your ability to do your research?
Oh, definitely. It took a very different turn to what field work is, because you can't be out in the field in the ways in which we typically imagine as health communication scholars or as anthropologists and sociologists, right? You can't go out to the field. So we had to get really creative during this period of time. I was very lucky because I had published a piece on digital ethnography before the pandemic had happened. I started investigating how the online space is a great medium to understand immigrant populations. So that's when I started doing a lot of my fieldwork online. I was able to get in touch with migrant workers back in Singapore via Google Call, Facebook chat sessions. I was able to use new media tools as a means to connect with migrant workers. I started studying how they were sort of talking about their structural conditions on TikTok, which is a new social media platform that migrant workers are actually using to convey these health messages or rather these health situations or the context that they were in. So really starting to get very, very innovative, even just using the mobile phone, WhatsApp calls to do some of these field work. So it never stopped me in terms of not being able to access in physical situations, but just really getting creative about how you might have to reimagine doing field work in the online context.
I'm going to pause for a moment just to invite our audience. Please remember that we invite you to ask questions, to put them in the comment box for Satveer. There's so many things that we could ask Satveer. So please, if there's an interest of yours, please put it in the comments section. So there are many researchers who will likely listen to this. And as you said, you kept it going. Now, any tips for researchers in the audience, or for me, an interviewer, how do you conduct an interview differently when it's online versus face-to-face? Did you learn any good tips along the way to make that a more dynamic conversation or a more comfortable conversation? Because you're not in the same place. You can't offer tea or do some of the normal niceties to make it a relaxed conversation.
So the first thing is always respect your participants and the medium that they choose to speak to you on. I think that's really, really important. I'm working with migrant domestic workers and migrant construction workers who have their employers around them. For example, domestic workers have their employers potentially surveilling them during these conversations. Migrant construction workers can't speak to us except on their off days. So being really, really respectful to their needs, your participants' needs, they are giving you their time and their stories. So one is the ways in which they can engage with you in terms of timeline and the structural sort of environment that they are in. Two would be to think about what is the best way in which they can tell their stories. What are the best ways in which they can articulate their best storytelling practices about their lived experiences. So being open to diverse techniques, right? So I would have a domestic worker who would plug in with her earpiece on her mobile phone, and during the interview, she might have to keep looking back and being comfortable with that, and telling her, I understand your situation. Let's chat whenever you're comfortable. At any point in time, you need to take a pause. No issue at all. We don't have to do it in a traditional interview style. I understand the environment that you're in, and just sort of giving that respect to the participant, and also be very open to different formats, right, of understanding. So with migrant construction workers, they tell stories through poems. So a lot of times they might articulate their lived experiences in an interview through poems. Be open to alternative forms of knowledge production, right? As a researcher, don't limit sort of your lens about what constitutes knowledge or what types of stories you need to hear. Always give that respect and that power to your participants to tell their stories.
I was so moved by what you just said, because I've studied many languages, and sometimes you learn as you're acquiring linguistic skills that it isn't always just about vocabulary, because you do have different cultures and they have different ways of communicating and telling stories. And your example that some people might convey a story through a poem, that was fascinating and so true as I've traveled around the world, different people. So flexibility, that's the main key, flexibility. Now, you brought up a number of issues that you were researching in terms of migrant health and access to public services. So tell us a little bit about what you've seen or what you've researched in Singapore in terms of access to healthcare for migrants. What are some of the challenges that they face?
I think in the initial phases of the outbreak, of the COVID-19 outbreak, right at the very start, because of all of the confusion and the lack of understanding of what was taking place, not just within the migrant worker community, right, among all of us. For migrant workers, this was even harder because they were negotiating an environment that was not exactly easy in terms of practicing safe distancing or having masks or being able to access soaps and sanitizers, right? So for them, they live in dormitories, oftentimes migrant construction workers, where you have workers that reside in very close populations together, right? It's not space-wide, it's space constrained. They don't have access a lot of times to soap and sanitizer, right? Just very basic sanitation resources. They're cooking in very crowded confines. They're making meals that are within like spaces that are utilized by multiple people. Even water, right? Drinking water comes from a pipe that is shared by multiple workers. So to have this expectation that they were going to be able to practice safe distancing, that they were going to be able to use sanitization or use or adopt sanitization practices, it's a bit of a top-down lens rather than a lens that interrogates the structure in which they reside. That's a big problem to me, because then we're really not understanding the lived experiences of how these workers are going to face serious challenges with navigating the outbreak. That is very different to the community population in Singapore, right? Or the Singaporean that has a home with two people in their home. They can easily quarantine, without any issues. They're able to practice safe distancing, sanitizers, masking behaviors were easy to sort of access, right, in the initial phases of the outbreak. So those are some of the, I think, the challenges that were facing migrant populations during the initial phases of the outbreak.
I have a follow-up question on that for sure, but I want to get to a question from our audience. This is from Tran Ho, and Tran Ho would like to know just a little bit more general information about the Fulbright Scholarship application process. If you could just talk a little bit about that process and share what your experience was and maybe some tips. Tran Ho is from Ho Chi Minh City.
So Tran, I was very lucky to have various mentors that sort of were able to speak with me and to talk to me about the Fulbright Fellowship. I also had various individuals from the US Embassy speak with me about the Fulbright when I asked questions. So I would be, Tran, I'm just sort of putting this out there that I'm happy to speak with you. You can drop me an email if you'd like to know more about the Fulbright application, how to shape your application packet, thinking about, again, the topic. So I know different Fulbright fellowships have different interests on topics that people are doing. In my Fulbright application, there was a big focus on issues of human trafficking. I think there's a deep connection between migration and human trafficking that I was able to speak to in the call. So you want to sort of also ensure that you're speaking to the application and what it's asking for. So those are some quick tips, and I'm happy to once again speak with you further if you'd like via email to share more about the application process.
That is a wonderful offer, Satveer. We'll make sure, to our audience, we'll make sure that Satveer's contact information is in the description of this video, and we'll put a little more information about Fulbright as well. We're happy to offer you more information on that. And we did get another question, and this is, let's see. Oh, this question is, were people in the United States aware about migrant issues in Southeast Asia?
So I was again at UC Berkeley, where there is huge conversations going on about migrants and migration, right? Also, the theorizing of migration was done at a much more meta level. So we were thinking about the ways in which migration is organized and how that sort of impacts different parts of the world. So it was easy to have that conversation at UC Berkeley simply because there was already a big conversation on migration and a meta theorizing of migration. And even if there wasn't, I think it's easy for us to kind of draw parallels, right? Like, how do we then connect the issue of the migrant work situation in Southeast Asia to that of the US, for example? So drawing those parallels and helping them understand what those connections might be. So in the US context, for example, I would be thinking about undocumented workers or temporary authorized workers, migrant workers that reside in those in various parts of the US. And then we can think about what parallels do they draw. So with not having papers or having to provide papers, for example, during vaccination rollouts, right? Currently, that is something that they will not be able to sort of access simply because of the precarity of their situation. And then drawing parallels to that to other types of migrant workers in the Southeast Asian context that might have shared experiences. So I don't think it's it will be a difficult conversation to have. Those parallels can be seen, right? Transnational migration is something that is taking place all over the globe. There are going to be interconnections and shared experiences that we can draw parallels to. I hope that answered your question.
Thank you. And I forgot to say that question came from Elisu from Indonesia. So as you were saying, the issue of migration is relatable for people in every country. Every country has migrants, and there are always these concerns and these issues. And there are also concerns of what you were saying earlier about sanitation. Just today I was reading documents because it's World Water Day, and the issue of access to clean water, that's something every country is challenged by. And the issue of access to sanitizers, to soap, all these kinds of issues. What would you recommend to a young leader in Southeast Asia who wanted to focus on these kinds of issues, sanitation, water, access to soap, and particularly in the context of migrant communities? What is something that a Southeast Asian person could do about this?
I'm going to come to this question from the perspective of a communication scholar. I think it's very important when thinking about some of these wicked problems or social issues to always go back to your community and ask. Get them on board with your problem identification. Get them on board with your co-designing of solutions. They need to have a voice in thinking about some of these issues. So let's say clean water, right? Access to clean water. Now, in thinking through the problem, right? How do you get access to clean water? What are the challenges that communities face accessing clean water? We don't have the answers, right? We need to understand the community. We need to sort of have access to their lived experience or make sense of their lived experiences, the challenges that they face, to be able to get to the solutioning, right? To be able to tailor solutions that work. So I come from a communication perspective by saying that always go back to the communities you're working with to ask them, right? Just simply ask them, what are the challenges that you face accessing clean water? How can we work together to solve those problems of accessing clean water, for example? Yeah.
Brilliant points. It's a community effort. Look into the human resources that you have in the community, people who have been working on these issues. Yeah. And to that point, the US government has given a variety of funds and grants to different programs throughout Southeast Asia. So we'll put a few that have to do with sanitation issues in the description later. But yes, go to the community, talk to political leaders, talk to community leaders, reach out to the Waisili Network, that's an embassy program. Find people who are working on this issue and ask questions. Because if you want to find a solution to a problem, you need information. You have to do that research part. It's an important integral part. And another thing that you mentioned was when you're talking to these people, find mentors, find people who've been working on this issue. And so I have a question for you. Either when you were in California for your research or in general, are there US leaders who you consider to be role models?
Absolutely. So right on the top of my head would be AOC. I think she's such an inspirational leader. I think the ways in which she's thinking about communities, inclusion of communities, of different groups, thinking about health as a human right. I would think she's extremely inspirational as a leader.
And for our audience, Satveer is referring to Alexandria Ocasio-Cortez, who's a member of the US Congress and has been doing a lot of work on healthcare and providing services to migrant communities. This is a great passion of hers and many people in our Congress who have been working on this issue. So thank you for sharing that. We do have another question from Tanya. And this is sort of a more general question, wanting to know if there were certain turning points in your life that helped you as you dealt with difficult moments. And she wants to know whether you have advice for women in particular, and perhaps women researchers who are faced with struggles and how you've pushed through that to be successful.
Hi, Tanya. Thank you so much for that very important question. So I want to immediately say that all of our journeys are going to face hurdles and difficulties and different barriers, right? A big part for the turning point for me has been interacting with an absolutely wonderful supervisor, interacting with mentors who support women, who are thinking about the ways in which they can help us move up the ladder in terms of any type of field that we are in. Just having these mentors, having a great supervisor, supportive supervisors that are really interested in ensuring that you succeed, that they provide you with these crutches to get there. That has been, I think, a big turning point in my life, just to have people that believe in me, that believe that I have value, that believe that I'm able to sort of work through academia, despite being a minority woman, where you might not have, other minority women that look like you often in occupying these spaces. So, just working with them to help myself sort of move up. And the advice that I have is that there are always going to be difficult points, right? There are always going to be times where you're going to be, wow, am I going to make it? Am I going to be able to succeed in this field? I keep telling myself that I'm going to be an environment that is supportive of me and my work. I want to create that infrastructure, that ecological environment that supports the work that I do, but also to always have faith in myself that this is not imposter syndrome. I can do this. I have value and I have worth. And having this positive self-talk a lot of times can help us navigate through some of the most difficult moments in our life. Having said that, I also don't want to say that we cannot ignore the structural context in which women's lives exist. There is going to be moments of patriarchy that we face. There is going to be moments where we face systemic structural challenges. But sort of working through that and finding access points and having faith that in ourselves, right, and in our self-worth to navigate some of these parts is really, really important. So constant positive self-talk that you can do it. Even saying this is hard for me because this has been a difficult journey for me as well. I keep telling myself that, and this is a constant conversation that I need to have. Yeah.
Do you have someone from your family who you call regularly who helps to give you that push?
I am very lucky because I have an immensely supportive partner who is a feminist. He is so oriented in feminist literature and understands the challenges that women face. So having him as a supportive partner, I think, has been immensely helpful in my journey, especially, and supporting me all the way through, and always giving me space. Always giving me space to be represented, to be recognized, and not occupying that space. So I would say my partner. I also want to give a shout out to my mother. My mother is a single mother. She's raised me single-handedly for most of her life. And I think she has been a big inspiration on what it means to be able to, work hard as a woman and shatter those glass ceilings. Yeah.
Fantastic. As you mentioned, it's always important to have people in our lives who pick us up when we're having a bad day, whether it's a romantic partner, members of our family, friends. We have to have that support structure because everyone has a bad day. Everyone has challenges. Nothing, if you want to make a big impact in your community, it's going to be hard. Nothing ever comes easily. So you do need those people to push you. Absolutely. So gosh, the time is just flying by, but I do want to ask you a few fun questions. So my first question, you were in California. So if you could return to the United States in 2022 and you could visit anywhere, where would you go?
Oh, wow, that's a difficult question.
Maybe someplace you didn't get to go to.
Sorry again. Sorry, could you repeat?
Someplace that you didn't get to visit while you were there.
I have not got to visit Atlanta, Georgia. That's probably where I would like to go. I know there's a thriving scene in Atlanta, Georgia. There's a lot of, there's a rich migrant population, as well as, just diverse communities. I think the food in Atlanta is great. One of my closest friends is from Atlanta. She's grown up there and she's spoken so much about it, and I never made it there. So that's probably somewhere I'd love to go. Yeah.
Oh, I want to join you. It's one of the places in the United States I still have never been. And when I talk to people who are from there, I just say Atlanta, Atlanta. They just love that city. So I'd love to find out why. So if I get the opportunity to visit Singapore, where would you recommend I visit?
Definitely go to a hawker center, for sure. Any hawker center, but make sure you go to a hawker center and have a meal, make some friends along the way. The hawker center scene is vibrant, it's diverse. You get to try good food for a really great cost. And that's where real Singapore, whatever real means, but I think where the heart of Singapore lies. Yeah, it's at the hawker center.
What's a specific Singaporean food that I should try?
So my favorite is carrot cake. it's not exactly carrot cake in terms of the cake. It's not a sweet dish. It's in fact a savory omelette. And that is my absolute favorite dish. It's great for breakfast, lunch, dinner. So it's just an omelette with radish and, you know, all sorts of spiciness and all of that. And I think that's my favorite dish in Singapore. So I would highly recommend it when you come to Singapore to try the carrot cake.
Oh, you had me with radishes. Love radishes. So, okay, that goes on the list. What, when you are having a bad day and you want to eat some food, a guilty pleasure, what food would you eat on that kind of a day? Would it be this carrot cake or something else?
So I've been having a bunch of tough days in the last week, very busy schedule, and my lovely partner has displayed a whole table of chocolates for me. So I think my go-to food would be chocolates. That's the guilty pleasure. But the carrot cake would be the meal, the guilty pleasure meal, the savory aspect. So first you have the carrot cake, then you go for the chocolates.
And one more food question. So do you eat durian at home or do you always go out to eat durian?
I eat no durian at all.
No durian. Out.
I don't like the smell of it. My partner does. So I have told him that he has to eat it outside. He cannot bring it back home.
And that's reasonable. Very reasonable. What is one of your favorite US movies?
Wow.
Just one of them. Doesn't have to be your all-time favorite, just one you really enjoy.
Wow, that's a Back to the Future.
Oh, a classic. Yeah, that's a good one. I'll recommend it to everyone. So we're about at the end of the interview, and what is something that you would like all Southeast Asians to know that you didn't get the chance to mention today in the interview?
To know about, is there anything specific or?
Anything about your research about migrant communities, about your experience in the United States? Just, it's your opportunity to add one more little point to the interview.
So I'm just going to give what I think might be a constructive and valuable sort of perspective to what anyone that might be applying for a Fulbright or might be interested in this space is to always network. I have found networking to be especially helpful. You know, we often don't realize the value of just emailing a professor or emailing somebody in the US or from a different part of the world to say, hey, you know, I'm very interested in this. Is there any opportunity to chat? You know, people are very receptive, you know, surprisingly receptive to always finding ways to network, getting in touch with different people, always be open to and not fearful of writing or talking to different people that are around you. So I think networking is a big sort of a way in which I would think about my advice I would give to anyone that might be thinking about a Fulbright Fellowship or might be thinking about engaging in a project, a community project. Just keep networking, talking to different people. You never know who might get in touch with you, who might be interested in your work, who might fund your work, or who might connect you to funders, right? So networking, I think, is something that can be a very, very useful tool for anyone. Yeah.
That is wonderful advice. And we at the mission, we recommend that all the time. We have something called the Young Southeast Asians Leadership Initiative. That is a fantastic way to network and meet people virtually for now. Eventually we'll have in-person gatherings again, but absolutely networking. There are so many exciting Southeast Asian leaders such as yourself who are doing amazing things. And we have more power and more of an impact if we work with others. So I absolutely take what you're saying. Wow, Satveer, the time flew by. It's such a delight talking to you. Thank you so much for sharing all of your ideas with our audience. We had a bunch more questions for the audience. We could go another hour, I'm sure. But I just want to thank you so much for joining us. To the audience, we will put Satveer's information below so that you can contact her. We'll put more information about the Fulbright program and other initiatives. There's so much to discover. And if we can provide more information to you, please put a comment below and we will respond. So again, Satveer, thank you so much. Keep up the good work. Continue making an impact in your community, and we will definitely stay in touch. Thank you so much.
Thank you so much, Jason. It's lovely speaking with you. Thank you very much. Thank you.